That Miami-Dade has seen positivity rates so high over the last couple of days. It's a reflection of the reality that there is increased transmission going on. So beyond identifying the number of cases that were being transmitted before, this increase in percent positivity reflects exactly that. There's more transmission happening. Do I think that this might strain the hospital systems? It is already starting to strain our hospital systems. My colleagues and I are now facing a lot more hospitalizations once again. The ICUs are again seeing more patients. We're not there yet, but if we continue on this path, we're going to be running out of vital equipment. We may run out of oxygen, we may run out of remdesivir, we may run out of steroids, all kinds of medications, all kinds of things that we need to help people stay alive. Do I think that the people in South Florida are taking this seriously enough? Some are not. And unfortunately, those who are not taking this seriously enough are driving our new numbers. Why do I think that this spike is happening? This spike that we're seeing now, it's not just a spike. It started more slowly and now it's going up and up and up, and it will continue to do so, and it's all behavior driven. Remember, this virus is this little bit of genetic information, sugar in a protein, sugar-coated protein capsule that wants to get from one host to another, and anything in our behavior that facilitates that, it's going to take. And there's plenty of people who have not yet encountered the virus, and even among those who have, there's a lot of data showing that the immunologic reaction by a lot of people is not sufficient to necessarily keep them from getting reinfected. So our behavior is driving this spike. Do all the protests contribute to the spike? Again, anything that brings people close together in situations where they're not using masks, where they are acting in such a way that it allows for the transmission of the virus, is going to contribute to an increased number of cases. And let's be very clear on this. As we see an increased number of cases, which in this instance we're seeing it primarily in younger individuals, because they're the ones who are mostly taking these risky behaviors, a lot of those young individuals live in multi-generational households or are frequent contact with other people who are more susceptible, and invariably they've already spread this. So even if we were right now today to adhere to the new normal guidelines, we will continue to see an upsurge for a few more days or even a week or two as the natural history of this disease progresses. If we do not adhere to the new natural guidelines, the new normal guidelines, you will still see a spike, but it'll be sharper, it'll be longer, and it'll be a lot worse, to the point that it may seriously impact on our ability to provide the kind of health care we need to provide to keep people from dying from COVID-19. So it's really important that we adhere to these new normal guidelines. Do I think that we'll have to reimpose restrictions? I sure hope not. I think that it is incredibly vital that we keep our economy going. However, it really depends on us. We have to be very serious about this. We have to follow the new normal guidelines. We have to wear masks when we're out and about. And the mayor is considering adding a restriction with the mask, in the sense of making it a civil problem, not just a criminal problem, not to be wearing masks outside or inside in Miami-Dade. And that's a very important measure. We have to use the hygiene, we have to keep that 6-foot distance, and we have to be very serious about it, or yes, things can get much worse.